wanted me to talk a little bit about healthcare in young people and how it affects young people. And it's an issue I think that a lot of young people don't realize actually does have a pretty significant impact on them. Young people a lot of times tend not to have insurance because they're relatively healthy, even though insurance, if you're young and healthy, is pretty cheap. But a lot of people choose to go without and just pay out of pocket because they don't really have a whole lot of expenses. But one of the things that you find that happens after you get a little bit older is that you start to have things like pre-existing conditions, which are, if you have a history of disease, it really does start to affect you, and it can affect your ability to get insurance. Once you have a pre-existing condition, under our current system, it's almost impossible to get healthcare insurance at a reasonable rate, if at all. And many of the things that you would think of as pre-existing condition, I mean diabetes and so on, heart attacks, strokes, are the ones that you sort of think of, but there are many other things that are pre-existing conditions that you don't so much think of, and that would include things like, in Texas, it could be being beaten by your husband, could make you ineligible for health care insurance because you're at a higher risk. Being overweight or underweight, even if you're just a child, can make you ineligible. What the reforms do, everyone talks about the public option, and that's an important part of it. But there really are a lot of consumer protections that protect everyone, and those are things like eliminating pre-existing conditions. So you can't be denied coverage because of pre-existing conditions. There'll be a cap on what you can have to pay out of pocket every year. There won't be lifetime maximums right now as you go through things. There are, a lot of times you'll have coverage for dental care or something, but there'll be a maximum for a year for a lifetime. I had an insurance policy that had a lifetime maximum of all services of $1 million, which sounds like a lot, except if you get really sick, you can go through the million right away. All of that will be eliminated, and so those are very significant reforms, even without the public option. There will be a public option to help encourage competition. The president believes that that's really important, and that seems to be the direction that people are moving in. So if you have, now part of that is that there will be a mandate